Hey, Rick Giannotti here, Healthcare Nation podcast, doing a set of healthcare predictions for 2026. I've done this the last couple of years, gotten some good feedback, and thought I'd do it again. Not an all-inclusive list, but I think some of the challenges that are going to be facing health sector leaders as we look forward to the next 12 months. So all said, in no particular order, let's start with politics. So I think political change won't bring the sweeping reforms perhaps many want, but it's going to bring, unfortunately, more volatility. Payment shifts in Medicare Advantage, risk adjustment, Part D, creating more uncertainty. The risk here isn't ideology, it's really unpredictability, and those organizations that hardwire financial resilience are going to be, I think, on top versus those who won't. Number two, the Affordable Care Act. This is going to be the operational shock for 2026. If subsidies lapse, right, or extend late, premiums are going to rise, enrollment's going to fall, and delayed care is going to show up in emergency departments across the country. This is where policy risk becomes a front door issue for hospitals and health systems. So be prepared, or be as best prepared as you can. Three, technology. It's going to stop becoming transformation and start becoming the way we do business around here. Whether it's virtual nursing, scribes, AI triage, command centers, these aren't innovation projects anymore. They're really essential workforce adjacents. Budget for them, start thinking about how you're going to deploy them and make it happen in 2026. Number four, cybersecurity, becoming more of a clinical risk perhaps than ever before. Downtime does indeed harm patients, and boards and leaders are not going to be judged by breaches alone. They're going to be really judged on how resilient their organizations are to mitigate those issues when they do indeed pop up. Number five, payer-provider relationships. They're going to get real in 2026, or more real than they perhaps have been before. Line by line, market by market, value, not volume, is going to define who has leverage and who doesn't. So think about that as you move forward with your contract negotiations. Number six, care moving outward, if I can characterize it that way. But the fight is really still in the middle when you think about strategy and tactics. Short stay, advanced urgent care, ambulatory hubs, new way to deliver healthcare in a very modern, leveraging technology fashion is going to be what we're looking for the future. Hospitals are going to get smaller, sharper, more acute. A lot of technology is going to be deployed in the home. That middle ground is where the fight's going to be. And lastly, geopolitics. This is going to quietly reshape healthcare economics. We saw this happen during the pandemic more acutely, but I think moving forward with the geopolitical uncertainty that's happening across the board and around the world, whether it's supply chain, capital costs, pharma, drug access, volatility is here to stay. So the bottom line for 2026, it's not about reacting to disruption, it's about having a durable and adaptive strategy. So with that said, have a happy, healthy, and safe new year, and I'll see you next year.